She dropped her HMO. About 3 weeks later, she turned in her chair, busted a rib. Realized she had breast cancer. No insurance company would touch her. Let's say the words together. Pre-existing condition. So just about all of the resources for my family were drained to take care of her cancer. She lived for about 2 more years. We need health insurance in this country that doesn't leave you because you can't afford it. We need health insurance in this country that doesn't leave you because you change your job. We need insurance in this country that is not driven by profit motivation, but by care motivation. And last, I want to say why your work and this work is so important. That ultimately, most of the power that is applied to the public conversation, most of the donations that are received by a member of the legislature or by the member of Congress, are given by folks with a particular interest in mind, generally a very particular financial self-interest in mind. And if you look at the contribution expenditure reports of most of these folks, you'll realize, and that's, by the way, where you have to get your money to win, because frankly, it's really expensive these days. And we can have another rally about campaign finance reform. And we can have another rally about getting everybody here to make sure we are participating in politics so there's a little more power for the public interest. But a huge portion of our problems are nobody's job, at least in a market sense. Whose job is it to make sure that we have health insurance that, well, let's look at the realities of healthcare costs. In 1973, healthcare was 6% of the gross domestic product. It is now about 15–16%, with no decline.
Single payer! Single payer!
You don't need to lobby me, baby. That's why we're setting this off.
No! You're
Here,
not for single payer!
let's have your chant. Let's have your chant. Let's have your chant. I said it. I said it.
Lead the chant, man!
I'll finish. I'm an invited guest. I'll finish. You want me to finish or I'll leave. But you shouldn't be lobbying me. I'm not looking for teabaggers in this crowd. That we need, as much as anything, to start applying more publicly interested power to our decision-making process. Whatever happens in Washington, this fight will not be over. Whatever happens tomorrow and the next day, and as this tour goes along, this fight will not be over. We need to be building a power pod. We need to be building power sets for publicly interested objectives, including healthcare reform, including the single-payer conversation, including making sure that we don't merely apply the power of the self-interest